So today I performed robotic cholecystectomy. Briefly, that usually most commonly it is performed laparoscopically. Now with the availability of robot with our place, we are operating is robotically. So the ease of doing definitely is there. So from all the angles you can approach. For the difficult cholecystectomy, it is much better. Like many times I give a your example, like for example Mirizzi syndrome or any other difficulty where gallbladder is stuck too much all around, so the dissection visibility is much more. By reaching from all the sides, you can see from all the angulation and dissect from all the sides has become easier for dissecting. And same time, the hemostasis also becomes easy when you can see from all the sides. It was excellent. I used to operate other robots also. So this was like good operating my day-to-day surgeries with the robot. It's the best comfort is you don't have to wash up. You can operate from the other side. And dissection, beauty of dissection is definitely great. You see the much bigger picture and you dissect very less area. So that definitely will help in patient recovery, and angulation with from all the angles you can operate. That is the best thing. So best thing about that, you don't have to put your head inside the console. So you can see from outside and comfortably you can move your neck and all. You can operate with there, and with the finger movement is just like whatever you can guide. The freedom of the movement is there. The hand clutches are not fixed at one place. You can move at your ease. So that definitely it's reaching from all the angles. That is the best thing, and you can angulate the instruments and camera accordingly to reach at the desired point wherever, like in the difficult situations or bleeding or where the much adhesion is there, so we can do dissect fiber by fiber that dissection, or from down to above, that is also possible. We don't have to bend our body, and it's just from the wrist movements it can be achieved. This system has, again I'll emphasize the same thing, this has helped in the reaching from all the angles, and that is where many times we are not able to suture from few angles. So laparoscopically that suturing was the difficult, and with this system definitely if we can reach from all the angles, we can suture above also and down also, and dissection of the peritoneum or the dissection of the organ, it becomes very easy with this. I'll say learning curves are less compared to the laparoscopy. We remember the laparoscopy where of course you need to have around 30 cases, 30 to 40 cases for learning. Here I think 8 to 10 cases are enough, and we have been operating in the other robot, then it's even less on that. You just need to practice for the system. That's the much desired, and whatever they provide good and all, but still the support system is that as much you get, you want more definitely. So we aspire to get more support, and definitely, and whatever support they are giving, that is also good, but we are always aspire to have a more and more support. Best thing about the SSI Mantra is the cost. Definitely, cost is a very less to the patient, so we can use in the many surgeries. We can offer to many patients who cannot afford, who cannot think about the robotic surgery, they can also be offered the robotic surgery. This is the best thing. And day by day, SSI Mantra is also improving. So whatever challenges minimal it is there, so they are getting solved. So day by day, it's getting better.